Our companies have kind of 3 steps, pretty obvious stuff really. In a first incubator step, that first not triangle, but arrow shape, that's kind of 12 to 18 months, 12 hopefully. And that's where we've first taken the idea, put it in a company, and we're very hands-on, we're very involved. We write business plans, we build websites, we recruit early management. We have this concept, which is called the rower. That's actually somebody who's going to row the boat, kind of manager. He's not going to be the guy, he or she, sorry. He's not going to be the person that's going to float the company. Probably not. Might grow into it, but probably not. But they're the kind of rower. Somebody who might come along and, most importantly, is they wake up in the morning and they think company, and they work all day thinking company, and they go to bed thinking company. You need that. We found at the beginning, when we started some of our companies, you had kind of part-time consultants, and then you had non-exec boards. And quite frankly, nothing happened until every month. You all met again and then talked about it, and then nothing much happened for another month. You need that kind of guy in there. So they put those people in there, and we do all that very early stage company stuff. Fusion traditionally tended to fund those on its own, normally put about a couple of 100,000 in at that stage. As I'll explain in a minute, we often get people to help us now, because it's a lonely place on your own. Second stage, I guess this is more like 12 to 36 months. That's where we're beginning to turn into more like a company. You might beef up the management team. Hopefully Fusion's less involved, because the management team takes on its own responsibility. You've always got third-party investors coming in. If this is a physical sciences business, that'll be beginning to talk about making sales. In life science, particularly drug development, it'll be talking about preparing for a phase 1 trial, if that means anything to anyone, thinking about starting to put it into the human. And then there's what we call step 3, the last one. Step 3, you're like a proper company. So physical sciences, that's trading, that's making sales, probably. Life science is probably in the therapeutic side, drug development, That's going into a phase 1 clinical trial. So first banging into people and seeing whether they survive or not. So, and at that stage, that's where it starts getting expensive for Fusion, because we are, obviously, compared to a normal VC, we're pretty small players. We're an incubator, really, more than a VC. We haven't got loads of money. Probably only do 750,000 per company. So at that stage, we financially back out. Here's the master plan. The master plan is you start with 60% of the company. In the early, very dilutive rounds, where the values are low, when you first start a company, it's probably only worth £500,000. In those early stages, we try and hold our corner, what we call hold our corner. Put in as much money as the others so that we don't dilute too much, if that makes any mathematical sense. If you can put in the same amount as everyone else, you should remain pretty much where you started. So those early rounds we're trying to put in to try and keep a relatively decent holding. And then only at the end, once the value's perhaps gained a bit, still not enormous values, but maybe pre-money 5 million or something. Pre-money, I mean the value of the company before you've put money into it. That's what I mean by pre-money. So if you have a company worth 5 million and you put $1 million in, it's worth post 6 million. So sort of pre-money 5 million, that sort of stage. That's where we hope to be by phase or stage 3 of our company's developments. As I say, we back out, but hopefully, even then, if you raise, let's say, a couple of million, you still don't dilute too much. Now, you'd still own your share of the 5 out of 7, so you've diluted, 30%, but it's still very much in the game still. We are joined by partners, increasingly have partners. Finance Wales and Wales are absolutely brilliant. I say this every time, but genuinely they're absolutely brilliant. They're completely supportive. They understand risks. They're very diligent. They go through all our stuff very thoroughly, but they're always there and always very supportive of stuff we're doing in Wales. And we would have had a much, much harder job without them. They've come into about 7 of our investments so far. And I think it's a very, very good partnership, because obviously we try and do as much of the work for them as possible. So rather than just, I think without a Fusion, you'd be tending to give people pretty raw sort of, here's a chap or a team in a lab with some ideas. We try and say, here's a company, here's a business plan, here's a website, here's a management team, here are file patents, to try and give something that's much more investable for a third-party investor. And there are people, a team called IP Group, who are like us. Not quite the same, because they're not owned by the universities, but they're a publicly listed company that has about 10 university relationships, and they've taken a 20% stake in Fusion, and now increasingly they're putting money into our companies. So that's all good. So that's very much our model. You'll be glad I've only got 5 minutes left. People often say, what stage, or what step, I should say, do your companies fall into? Well, there they are. Not that relevant. I'll very quickly just touch on a couple. That's what I'll do. I'll do a really quick elevator pitch, which is good, because then you won't realise how little I really understand of them. This is a company called Diurnal, which is a company we own quite a lot of, about 52%. It actually started out in Sheffield, but it's a spin-in. We've spun it into here, and we've raised money in Wales for it, and now all the money we spend in Wales, either at the university or with Welsh companies, which seems like a jolly good idea. Finance Wales are investors with us. It's actually ridiculously simple. You have what's called a circadian rhythm. That's kind of rhythm, your natural rhythm in which certain hormones are being released in your body. So when you go to sleep, particularly circadian rhythm is low. During the night it picks up. So when you wake up, you've kind of got that boost of energy you need to get going. Certain drugs have not been administered traditionally in accordance with that rhythm. They tend to get just administered like an aspirin regime. You take one every 4 hours and you get spikes. So all it was not tough, this is it. The pattern was, why don't we deliver it in accordance with the circadian rhythm? That's all we've done. Simple formulation, what they call a multi-particular formulation up there. A bit like, I think it's called Contact 2000, if you're old enough to remember the adverts. Whole load of little beads in a capsule which release at different speeds and mimic this rhythm. Really simple. Just finished our phase 1 trial, looks pretty good. Hope to finish our phase 2 trial about 14 months' time, sort of third quarter of next year. And fun enough, we should have something quite valuable then. Because if you've got a drug, it's only a small market we'll get. Small. It's about 100 million, actually, which is small in, obviously, in therapeutic, pharmaceutical markets, but big enough. So hopefully by then, by the time we get to the end of stage 2, if it's working like it looks like it is, you've got something worth a little bit of money there. Probably worth quite a lot more than our market cap anyway, which would be nice. Mesuro, another one, straight out of Cardiff, out of the laboratories in Cardiff. Very interesting company, this one, because it allowed us to get to market very quickly. You'll throw rotten tomatoes at me, but basically you have in telephones and in telephone base stations things called power amplifiers. They transmit using different frequencies, but they're using more than one frequency. And the trick is to try and harmonise those frequencies. The more you can harmonise them, the less power you need to transmit. So you either use less power or you can get better signal. And effectively, the chaps in the labs have developed a device that allows you, not just by iteration, not by trial and error, but a device that actually perfects that harmony. So you get the best harmonic. So now, theoretically, we're not doing this, but theoretically, you should be able to reduce the amount of power used by a telephone base station by about half if you could perfect the harmonic. And put that in perspective, telephone base stations are using 1% of the whole national grid nowadays. So it's quite a significant potential. It's an interesting company. As I say, it's been going about 14, 15 months. We're lined up for our first sales, we hope. Within 3 or 4 months, we had the box. Look, a real product in the middle, that's our box. That actually sells for about $300,000. We've got about 8 or 9 companies at the moment, 2 or 3 of which are fairly imminent on the sale. Let's see. You know, these companies are always difficult, they're always high risk. But if we can start making sales, that'd be an interesting company. All based in Wales, doing manufacturing here, etc. Probably the last one, if I got 1 minute, Salus. Dominic would be best to talk about that. He knows an awful lot more about that. These are some medical devices. Again, all come out of Cardiff University. Again, only started about 12 months ago, something like that. And these are products for use in laparoscopic surgery, keyhole surgery, about here in the midriff region, keyhole surgery. And what's neat about these is, again, speed to market. At the very beginning, we got very much into therapeutic, into drugs. And that's because you have this enormous, you see companies going for hundreds of millions, which is great. The problem is they take a heck of a long time, and the problem is an awful lot of them fail getting there. And the nice thing about having a bit of a more balanced portfolio, not just drugs, but medical devices, which is what this is they still take a while, but they're comparatively quicker. These will go from 2 years from start to being licensed and being used, we hope. And comparatively much less risky. You're not actually injecting new chemical entities into people, for example. So 3 different devices. You're saved by the bell. I won't go through all of them, because it's exactly half past. So there's our summary. Completely integrated with Cardiff University. We are effectively a chunk of Cardiff University for all intents and purposes. We've got about 9 years left on this agreement. It's a pipeline agreement. So we've got a nice long time. It's a bit of an overclaim there, so it's more like 8, isn't it? Anyway, we have a procedure in place. We have a team in place. There's 9 of us all in place, 20 companies, and we say at least 6. I'd say there's about 9 or 10 of them now that are looking like potentially very valuable companies. So, so far, so good.